This video is part of a collection of testimonials and stories about the personal and professional impacts of public health emergencies. This project aims to uplift authentic experience and impactful efforts to enhance the capabilities of agencies who serve maternal and child health populations and help guide their use of existing resources and implementation of best practices in their communities.
Nicole, LeBlanc. I live in Silver Spring, Maryland. I'm on the autism spectrum. I've worked in the disability field for 14 or so years, since October 2007, at the state and federal level. I currently serve as the PHEP coordinator for the National Center Advancing Person-Centered Practices, Self-Advocate Advisor, TASH, in addition to other consulting projects. I'm on the Maryland State Advisory Board on Autism.
Tell us about your personal experience navigating the COVID-19 pandemic and how your feelings shaped your response to the emergency.
During this pandemic, I've used EMDR, I've used massage, craniosacral, zero balancing, acupuncture, as far as dealing with mental health needs. Getting out, I'm always telling people, back up, stay out. I'm a vulnerable adult. And then of course, like, I really haven't used much public transit since, other than flying and whatnot. I haven't really used much public transit. Lyft has been my primary mode of transit. And right now with this, with states, getting rid of mask mandates, it makes the world more nerve-wracking. That as a society, we need to do more on preventing disease. And that, between healthy diet and good hygiene practices, we can have, less colds, norovirus, flu, on top of vaccine. Having dental closures was definitely a negative impact. That's, most of us in the autism world, dental work is the most difficult, and most of us operations, we try and put them off as long as possible. Somebody with low pain intolerance. During this pandemic, I also ended up moving twice. My friend who I lived, TNLs, who moved back to Chicago, I ended up moving into a 3-bedroom, 1-bath. Unfortunately, that arrangement didn't end up working out because I had people that would, because it was month to month, they wouldn't stay back out and they'd leave me stuck trying to, find housemates and pay somebody else's rent, which was definitely hard and stressful. Ultimately, in April of 2021, I ended up moving into a studio, finding a deal during March 2021 when they were giving out deals, move in, half off first month. Because of the money I saved in Able account and all the stimulus, I was able to become liberated and get rid of housemate chaos, which was a relief. We need to use this crisis as a way to get rid of all the bureaucracy, get rid of all the work disincentives, and just call it universal basic income. Being disabled is expensive.
What was the most significant takeaway or lesson learned from your experience?
That was, somewhat clear as mud before has made, everything much more difficult to figure out. This pandemic has, stolen our sense of safety. As a society, it's stolen our sense of safety. When we look at, risk management in this era, like at end of July, August, I'll be presenting at the Reinventing Quality Conference, talk about dignity of risk. And as we look toward, managing risk in this era, fend for yourself, and dignity of risk in the intersection. This, pandemic has shown that we need to move away from segregated settings to, more independent apartments. And all the flexibilities from Appendix K, telehealth should become permanent. One big thing with telehealth is it needs to be made more accessible. It's time for all government agencies to make their websites accessible, make it so we can easily fill out applications online, submit, and that's it. No printing a gazillion things, no running around in and out of FedEx. make Social Security so you can submit earlies online rather than print everything and mail it, and it's like, and right now, as you see businesses calling people back to offices, guys, the pandemic is not over. It's like, realize, we've all undergone, a major trauma.
How has the disability community been impacted by this emergency, and what do you feel needs to change?
Causes uncertainty. It's definitely stimulated to the non-disabled world what it's like to be disabled, and has shown everybody you can, go from, it's easy to go from, being perfectly healthy to being disabled in a split second. And you look at, it's time to make adjustments. When you look at, I've read stories of, long haulers, losing jobs because they can't make it through a day. It's like, we need to stop gaslighting and get serious about disability and accessibility. And we need to focus on, saving the planet, stopping climate change. A warming planet is going to mean greater threats of viral pathogens. We need to use this crisis right now so we never see anything like this again. Now we have monkeypox. Like, come on. It's time to have common sense, and it's time to get comfortable being uncomfortable. If you do not change, you become extinct. If there's any lesson to take away from this? People need to realize, when you have immunocompromised, something, may be, like a mild cold to somebody, but then to another person, it can be life or death. And if we all live long enough, we will all join the disability club. We need to change our way of thinking around disability.
What recommendations do you have for agencies who serve maternal and child health populations?
Material accessible, have people with disabilities and advocates at the table. One thing I don't think I mentioned is when it comes to vaccine access, we need equity. Access to vaccines, shouldn't just be based on who has the loudest advocates in their life. Many vaccine registration websites are inaccessible, and people with disabilities often have to go to a site that is far from their home. They can't just, walk into a local pharmacy and go get a COVID shot, booster shot. In the beginning, giving vaccines to doctors, provider agencies, centers for independent living, DD councils, to hold vaccine clinics would have been more ideal. And also bringing back doctor house call visits, nursing visits done by nurses to people's houses so that we can get our shots without having to worry about transit access and deal with inaccessible web applications would have made the COVID vaccine rollout much easier, much less stressful than getting the runaround and having to, get on, listservs and calls with all people with disabilities. So getting together, trying to problem solve vaccine access. It's time to end the divide between the privileged and the not so privileged. Equitable healthcare is needed now more than ever. We need to start engaging the disability community in pandemic prevention, mitigation, response, recovery efforts. We need more services for adults with autism, especially those without intellectual disability who have IQs that are, too high or aren't at risk of institutionalization. HCBS needs to be an entitlement. We should all be able to buy into HCBS. For many of us, having 3 hours of case management, 7 hours home support, and 14 hours or so job coaching, is like the bare minimum that keeps some of us stable. The crisis management like this requires somebody who can be calm, cool, collected, stable. When you look at our society, it's like, we're trained as a, we're like, mass hysteria is like part of our culture. Predictability, having calm demeanor, empathetic. trauma sensitive. Businesses, you need to be trauma sensitive. Mental health, the whole workforce is not going back. We're not going, we're not gonna, we have to face reality. What world was like before 2019 isn't coming back, and we need people to be honest, tell the truth. With all this, let's get to the truth.
Thank you, Nicole LeBlanc, for sharing your reflections on the COVID-19 pandemic and offering thoughtful considerations for the MCH workforce in responding to future public health emergencies. This anthology is curated by the Association of Maternal and Child Health Programs, or AMCHP, through a project funded by the Centers for Disease Control and Prevention, or CDC.